Hello, Curry County residents. My name is Jenny Williams, and I am the CEO for Curry Health Network. And today I wanted to give you some important information about the COVID vaccines, its status, and a little bit of information into how we will manage vaccines into the future. With a caveat that I'm going to provide information that is up to date as of today, but like the pandemic from the beginning, things are evolving rapidly and changing constantly. And there's still a lot of information that we don't have from either Oregon Health Authority or other sources. Bear with me as I share with you what I know, and I will share with you information that we are waiting for from other parties. So I wanted to start out by letting you know that Curry Health Network today has received 800 Moderna doses of vaccine, and we have verified that those are to be used for initial first doses, and that in approximately 4 weeks, we will be receiving our second dose allocation. So to date, 800 doses we have available to us to vaccinate those that have been identified by the Oregon Health Authority in phase 1A. We do expect to receive 100 additional doses next week, but what we don't have is information from the state, because the states don't have it from the feds, as to when we can expect to receive additional doses beyond what we know already. So 800 in hand, 100 more coming. Of those 900 doses, to date, we have vaccinated approximately 370 individuals that have been identified and wanting the vaccine in the Group 1A category. And we've been working with agencies to identify other individuals that are qualified that may want the vaccine. And our estimate is that based on the information we've received, that there are approximately a total of 460 individuals in the county that qualify and will want the vaccine. And we are prepared and working with agencies to schedule those appointments and get those folks vaccinated as quickly as possible. Now, the vaccines come in vials with 10 doses each, and we don't want to waste any doses. So we're scheduling people in groups of 10. And to date, we have a team of 3 of our staff members that are working Monday through Friday to vaccinate this group in 1A, and we're able to vaccinate about 40 people a day. To be honest, we could probably accommodate 50 people a day, but we haven't seen the demand necessarily to make that happen. So 40 people a day has been our current daily rate, if you will, as of recent. And as I mentioned, because we've already vaccinated 370 of the folks out of the 460, our demand for doses is certainly not outstripping our supply. And so we have reached out to Oregon Health Authority to better understand if, in fact, we can move into either phase B or some subset of phase B. And Oregon Health Authority, I just want to make clear, has not clearly identified who will be eligible in phase 1B. But they are anticipating sharing that with us as soon as they come up with that list of qualified individuals. We have learned that the state is published today that they believe the next group of individuals that will be vaccinated will be those that are working in the education system. That is yet to be confirmed, but that is what we're hearing as of today will be the next group of individuals that will become available for the vaccine. We also don't know, for example, of the doses that we have remaining from our 900, if we don't use them all in 1A, if in fact we're going to be asked to reallocate some of our doses to our long-term care facilities. Some long-term care facilities in Oregon have not received their allocated dose for staff and residents, and so we may be asked to reallocate some of our doses there. We're waiting from Oregon Health Authority to give us some clear direction as to what to do with the remaining doses that we have. Now, we will receive, as I said, our second doses starting exactly 4 weeks after we got our first doses. And so if you have been vaccinated already, you already have your appointment, we've been assured that those doses are coming to Curry Health Network. But again, what's unknown is the doses beyond this 1A, this initial allocation, and second doses for those groups of folks. I would say also that to date, Curry Health Network has not wasted one dose. So on days, for example, let's say we had 10 people scheduled in a certain time frame, but two individuals maybe just, for example, didn't show up. We are taking for those healthcare professionals, a backup list so that we can call people to make sure that we don't waste doses. So that's what we've been doing for Group 1A today. And I'm sorry, I'm just looking at some notes, so if I'm looking down at you, I apologize. Locations. I know that many of you are anxious to have the locations delivered to you close to home, and we are anxious to make that happen as well. Currently, Curry Health Network has received approval from Oregon Health Authority to administer the majority of the doses here at the hospital and some doses down at Curry Medical Center. However, we do not have the staffing resources, primarily in pharmacy and in nursing, to expand our vaccine schedules, if you will, to 2 locations. So for now, it is in 1 location here at the hospital. And I will mention that we are working to understand and have been just notified by the Oregon Health Authority that, in fact, we could reallocate doses to partner organizations that have approval from the Oregon Health Authority to administer the vaccines. And we'll be looking to those partners that have the authority and the ability to vaccinate folks, such as your primary care providers, even outside of the network. Also, Oregon Health Authority has said that they are beginning dialogue with pharmacies to see if they can help with the general public distribution. But for now, we're still in 1A. We're waiting for Oregon Health Authority to give us some direction as to how and when we can move forward beyond that. And we have a lot of unknowns about when doses will come to us beyond this initial few allocations. We've definitely been asked the question, so how do I know when it's my turn? And it's a great question. However, at this time, we're not taking a waiting list, so please don't call to get your name on a list. We are committed to communicating with you through social media on our website, and we'll use other forms of media as we can get things out in a timely manner. And we will continue to communicate with providers both within our network and in the county as to exactly what phase we're in based on Oregon Health Authority and who is eligible so that they can help communicate that message. I know that some of the physician offices are telling us their patients are inquiring when will it be their turn. I would mention also that Oregon Health Authority initially described phase 1B as essential workers and those over 65. They've recently reclassified that to be essential workers and those over 75. And yet they have not really defined what an essential worker is. And that's what they are working on as we speak. So just waiting to understand what that is. I do believe, because of the communication we had today, that people that work in our education systems will be part of that essential worker, and they are telling us that they will again be classified as the next priority group of people. So as soon as we know that's confirmed and we can move into that, like I said, we'll keep our website up to date. We'll be blasting that out on Facebook, and we will have a mechanism for you to email us and schedule an appointment to get your vaccine just as soon as that's possible. Other things I just want to mention, I know that you've seen on the TV certain communities that are really struggling either to administer the vaccine, or you can see lines in other states. So I want to be clear with everybody. Each state is setting their own rules. It's not one state is applicable to all, and so we are following Oregon Health Authority's guidelines, and we don't want to create massive lines. We do want to open up the vaccine distribution routes wherever we can. And so if Oregon Health Authority opens those up to pharmacies and we can partner with external agencies, I really do believe once doses are available, we'll be able to get those out to the public very rapidly. We've met with Oregon Health Authority very recently and shared with them that the numbers that we vaccinated in our process, and they really felt that we were a role model here in Oregon. So I'm proud for Curry County and our ability to move through this in a very organized manner. And although it may seem not timely enough for you all, I can assure you that we are working on plans so that when we get those doses in our hands, we can get them into your arms. I know also there's been questions related to, does the state, have they distributed all the doses that they have? And are they really making these vaccines available as quickly as they get it? And what I can tell you is, as of today, we have heard from the Oregon Health Authority that they do not have any vaccine doses in their possession that they have not already distributed or allocated to hospitals and health systems across Oregon. So I know that things feel like they're a little bottlenecked, and we're doing everything that we can. Just please try to be patient with us. And as I said, we will continue to communicate really as we know more and as we get direction from the Oregon Health Authority. And again, it will always be dependent on the number of doses we get and how quickly we get them. So I hope that you're all remaining masked up and appropriately distanced from one another, and that this information has been helpful to you. If you have questions, please feel free to email us on our website. We are actively monitoring our website page, and we'll continue to do everything we can to keep you informed. Thank you. Have a good night and a good weekend, and please stay safe.